It's very, very important to have a close relationship with your cardiologist when you have the diagnosis of heart failure. And again, it really has to do with focusing in on lifestyle and mortality. There has to be a trust there and a confidence there that you're not perfect and I can't be perfect, but we can kind of help each other out. I know patients that enjoy going to baseball games and they're going to want to have a hot dog and they're going to want to have a beer. And again, we don't do all of this because I want you to enjoy life. I want you to have a good quality of life. And so if your quality of life is tied into enjoying a baseball game with your grandson, I want you to be able to do that. And it's unrealistic to say that I'm never going to have a hot dog. Right? But you have to be comfortable telling me that. Now, Dr. Haynes is going to get mad at me, so I'm not going to tell her what I ate, but I'm gaining weight, so I need help. So in anticipation of a baseball game, I may say, okay, so we're going to this game, you're gonna have a hot dog and probably a beer and a half. So we may need to adjust your water pill. I need you to watch your weight for me. It's not gonna show up the day that you eat it. It may show up the next day or 2 days later, but when it comes, and it'll come, when that weight gain comes, you need to give me a call so we can adjust your water pills and maybe make them a little bit stronger. Maybe we'll double up for 2 or 3 days just to get that out. And that really gives us a co-management. So it's not just the doctor telling you what to do. And so if I know that you're eating a certain type of food or your lifestyle isn't conducive to low salt, or I had somebody whose electricity was shut off so they weren't cooking and they couldn't do certain things in the house. If I don't know those things, then some of my advice falls on deaf ears or it's not really applicable to you. That's why it's so important to have that trust. I need to trust you that you're telling me the right information. You need to be able to trust me that the information that you're sharing with me, I'm not going to be judging you. I'm just using it to help manage your heart failure, but I'm not passing judgment. The more I know you and the better you know me, the more we can effectively communicate. When you call me with a 2-pound weight gain, then I can adjust your water pill over the phone, save you the visit. You don't even have to come into the office, but I'm trying to keep you out of the hospital. And so the more you're able to recognize your symptoms at home and quickly communicate that with me, the better off we'll all be.